Urinary tract infections, or UTIs, are common. They happen when bacteria infect the urinary system. While often viewed as a straightforward infection, UTIs can sometimes take a surprising turn, especially in older adults. This unexpected twist is delirium, a sudden change in mental state. Imagine an older loved one suddenly becoming confused or disoriented. It can be alarming. While not everyone with a UTI will experience delirium, it's crucial to recognize the signs. Early recognition is vital. Prompt medical attention can make a significant difference in recovery. This exploration into the connection between UTIs and delirium aims to equip you with the knowledge to identify and address this often overlooked complication. Let's delve into the symptoms, understand the underlying reasons, and emphasize the importance of timely intervention. One of the most striking aspects of delirium associated with UTIs is the impact on cognitive function. It's like someone flipped a switch, and your loved one's thinking seems clouded. Confusion reigns, making it difficult for them to process information or make decisions. They might struggle to remember recent events or even familiar faces. Delusions, those firmly held false beliefs, can also take root. Imagine your loved one suddenly believing they're somewhere else or that someone is trying to harm them. Hallucinations, seeing or hearing things that aren't real, can further add to the confusion and fear. Disorganized thinking, characterized by rambling speech and difficulty following conversations, completes this unsettling cognitive picture. Beyond the cognitive shifts, delirium often announces itself through noticeable changes in behavior. An otherwise calm and collected individual might become agitated, restless, or even aggressive. They may pace the room, fidget incessantly, or have difficulty sitting still. Paranoia, a sense of suspicion and mistrust, can also emerge. Your loved one might start questioning your motives or those of caregivers. Conversely, they might withdraw into themselves, becoming quiet, unresponsive, and isolating themselves from social interaction. Increased anxiety further compounds the distress, creating a state of heightened worry and fear. While delirium affects the mind, it doesn't spare the body. The usual suspects of a UTI, fever, pain, or discomfort in the abdomen or lower back, might be present. But beyond these telltale signs, delirium can manifest physically in other ways. Fatigue and weakness are common companions of delirium. Your loved one might appear drained, lacking the energy to engage in their usual activities. This exhaustion can be mistaken for something else, masking the seriousness of the underlying UTI. Recognizing these physical symptoms is crucial. They provide valuable clues to help connect the dots. Section 5. Emotional roller coaster mood and UTI. The emotional landscape of someone experiencing delirium from a UTI can be turbulent. Imagine a sudden wave of sadness washing over your loved one, leaving them feeling depressed and hopeless. Moments later, the wave recedes, only to be replaced by irritability, anger, or frustration. These rapid mood swings can be distressing for both the individual and those around them. The emotional lability, the swift and unpredictable shifts in mood, adds another layer of complexity to the already challenging situation. Understanding that these emotional changes are often symptoms of the delirium, not personal attacks, can help caregivers and loved ones respond with empathy and patience. Section 6. Sleep-disrupted tossing and turning. Sleep, that precious respite for the mind and body, becomes a casualty when delirium sets in. Instead of peaceful slumber, the night brings disrupted sleep patterns, vivid dreams or nightmares, and frequent awakenings. Imagine your loved one waking up disoriented in the middle of the night, unsure of where they are or what's happening. This sleep disruption further exacerbates the cognitive and emotional symptoms, creating a vicious cycle. The lack of restorative sleep leaves the individual feeling even more fatigued and confused, adding to their distress. Section 7. The why behind the symptoms, unraveling the connection. You might be wondering why a UTI, primarily an infection of the urinary tract, can have such far-reaching effects on the brain. The answer lies in the body's complex response to infection. When bacteria invade the urinary tract, the body launches an inflammatory response. This response, while intended to fight off infection, can sometimes have unintended consequences, especially in older adults. Dehydration, a common complication of UTIs, further contributes to the problem. When the body is dehydrated, electrolytes, those essential minerals that regulate bodily functions, can become imbalanced. This imbalance can disrupt the delicate chemical balance in the brain, leading to delirium. Additionally, older adults often have pre-existing conditions that make them more susceptible to delirium. Section 8. Diagnosis and Treatment: A Path to Clarity. Diagnosing delirium caused by a UTI involves a multifaceted approach. Doctors will consider the individual's medical history, conduct a physical examination, and order urine tests to confirm the presence of infection. They may also perform blood tests to rule out other potential causes of delirium. Treatment typically involves a course of antibiotics to eradicate the infection. In addition to addressing the underlying UTI, managing the symptoms of delirium is crucial. This might involve creating a calm and reassuring environment, providing reorientation cues, and ensuring adequate hydration. In some cases, medications might be prescribed to manage agitation or other behavioral symptoms. Section 9. Early recognition is key: a call to action. The connection between UTIs and delirium, while often subtle, is a critical one to understand, especially when caring for older adults. Recognizing the cognitive, behavioral, physical, and emotional signs early on can make a world of difference. If you notice any sudden changes in your loved one's mental state or behavior, especially if they have a history of UTIs, seek medical attention promptly. Early diagnosis and treatment can help prevent complications and promote a faster recovery. Remember, knowledge is power, and by understanding the link between UTIs and delirium, you empower yourself to advocate for the well-being of yourself and your loved ones.